There's not a lot of anatomy associated with this lab. We really only have a couple of models. One of them is the lymphatics man model. The other one is actually that sagittal section of the head that has the tonsils labeled on it, and that's pretty much it for anatomy. So there's not a whole lot that gets tagged on this on the third practical that comes from the lymphatic system, just because there's not a lot to choose from. So we're going to talk a little physiology about the lymphatic system today. There are a couple of really good resources to utilize that are on Canvas that I'm going to pull up in just a second, kind of point out. Because I think it'll give you a little bit better perspective. The other thing I wanted to let you know is that coming up in the next few weeks, we are trying to set up some hands-on lab time. Now, this isn't going to be just like open lab and whoever can come. And I'm actually not handling the 254s, but there's going to be, and I'll post the times and the days and all that kind of stuff here coming up. Um, but starting not this week coming up, but the week after that, there's going to be times on Monday through Friday where people will be available in the study labs, I think, at City Park and on the West Bank to go over models and things like that. Um, so if you're interested in going to campus and getting your hands on some models and studying in that way, there's going to be blocks of time set out where faculty has volunteered to come and do these hands-on lab days, and it's going to be limited. Okay, it's going to be limited to about 8 people to sign up. So I'll post the information as soon as I get it with the sign up, so that if you want to go to campus and do some work on some models. I'm not sure who's doing the A&P2 stuff on each campus, or if it's even available on each campus. It just depends on how many faculty members signed up to do that. I, unfortunately for y'all, signed up to do the A&P1 stuff since that's my favorite. But if you're interested, reach out to me, and as soon as I get that information, I'll get you the sign up sheet. Because, like I said, it is on a first come, first served basis kind of thing. Um, Before we start, the practicals from last week, the anatomy practicals, overall, the practical grades were pretty good. I think the class average was like right around a 74 or 75. There were some really good grades on the practical. It was a pretty straightforward practical. Some of y'all made a few mistakes here and there, like forgetting rights and lefts, or some of y'all, even though I mentioned it, and not just y'all, but in both classes, when asked to identify the lobes on the lung, you labeled them as lobes on the liver, even though I warned you that that's a mistake that gets made every semester a little bit. Um, and I actually feel like the anatomy for this last practical, the third practical, I actually feel like it's the easiest. I'm not trying to make you complacent or anything like that, but I feel like the anatomy for the third practical with the reproductive, the urinary, and the lymphatic is probably the easiest set of materials. So, keep that in mind. I think most everybody did your vital capacity extra credit. So, as soon as y'all get done with the exam today, I'm going to get those graded, and I'll add that extra credit for the vital capacity onto the physiology test that y'all are taking today. Any questions before we get going? Y'all are awake, y'all are living, y'all are alive. Okay, you're almost there. All right. You only got about a month left, about 4 weeks, and you'll be finished with this. All right. So, like I said, I won't take too long today. We will get you out of here as soon as we can so that y'all can go study, because I'm sure you would rather be studying than be listening to me talk about the lymphatic system. I did want to point out, though, a couple of things in the Canvas and the virtual lab materials. The anatomy lectures right here. This is something that Mr. McCurdy put together. These are videos of him going through the models, kind of like the videos that Dr. Worrell did. So if that helped you, to hear and to see them pointing to the structures. I believe on the anatomy lectures for this one, Mr. McCurdy actually also did some histology with that through the microscope. So it's not just, up on the screen or something. So you may want to take a look at that. And then there's this really good video here, this adaptive immunity lecture that is through Wiley. It's an animated little video that I think is done really well to help to describe the adaptive immunity process, the difference between T cells and B cells, and how they attack. So it just may be something that you maybe want to go and watch and listen to. It'll help you on the physiology in here, but it'll also probably help you on the lecture test as well. I don't know where everybody is in lecture. I'm hope y'all should be roughly in the same place that we are here, but I know sometimes people get ahead or get behind, and it doesn't stay synced up perfectly. And then here's your link to the Quizlet that we're going to look at today. And the Quizlet is a couple of things. One, it is this model right here. I'm actually not going to take time to go over the model. I'll let y'all kind of, study this because it is just one model with these vessels and these nodes labeled. It's pretty straightforward when you're labeling lymph nodes and when you're labeling vessels, because most of the lymph nodes are going to be named for the regions that we find the lymph nodes, such as, cervical lymph nodes or axillary lymph nodes or inguinal lymph nodes or intestinal lymph nodes. So, as you go through, kind of keep that in mind as you're practicing the labeling on this. But I'm not going to take up too much time today going over this because, like I said, I know that y'all want to go focus on the physiology test, since I did look and see, and nobody's taken it yet. So I know y'all are cramming in as much information as you can, so you could probably take it this evening. So let's talk a little bit about the lymphatic system. Lymphatic system has three primary functions. The function that we're most familiar with, obviously, is going to be the immune protection that the lymphatic system provides. The immune system, or the lymphatic system, is going to help to develop the cells that we're going to use in different type of mediated responses to pathogens. The antigens that we find on the surface of the cells, like we talked about kind of in blood, those antigens are going to help to initiate the production of antibodies. These antibodies are going to be used to help us to fight off certain antigens, so that when we come in contact with a certain virus or a certain bacteria, the next time we come in contact with them, we have antibodies that have been produced that can recognize and then fight off that particular antigen. So that, of course, is the primary thing that we associate with the lymphatic system, and should be usually the first thing that kind of pops into people's minds. But we also use the lymphatic system to help absorb fluids. The majority of the absorption of fluids and the circulation of fluids is going to be done by the circulatory system, and we're going to do that using veins and the blood plasma. But about a 15% of our interstitial fluid is going to be collected and circulated as lymph through the lymphatic system. As we circulate the lymph through the lymphatic system, it's then going to eventually be returned back into the circulation of the cardiovascular system through the right and left subclavian veins. Lymph has a consistency and a makeup that is very similar to blood plasma. Essentially, it's almost just like blood plasma. So there's no problem mixing lymph in with blood, because it's just going to, kind of, merge in with the blood and not really affect or make any changes to the blood itself. The absorption of dietary fats. This is also going to be a function of the lymphatic system. The absorption of dietary fats, we know, comes from the lacteals that we find in the hold on a second, y'all. Sorry about this. My wife just texted me something and I got to answer real quick. So Um, uh, Dietary fats. We know the lacteals that we find in the digestive system are going to help to absorb the very large molecules that we can't normally absorb through the intestinal wall. And this is going to be done to help to get those dietary fats then into the circulatory system, the same way that we're going to empty the lymph back into the circulatory system at the right and left subclavian veins. So we'll kind of touch on these a little bit more kind of as we go through this, and 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 we'll explain a little bit more as we go. I'm gonna have to turn this off. Lymphatic vessels. Lymphatic vessels are going to have a makeup that's very, very similar to that of our veins, right? They're going to be very thin walled vessels. They're going to have valves set in place. The reason that we have valves set in place in the lymphatic system is because we don't have any means of circulation in the lymphatic system. There's no heart, okay, of the lymphatic system that's going to be used to help to pump lymph through the lymphatic system. Instead, we're going to rely on the thoracic draw, okay, that we talked about. That's created when we have negative pressure in the thoracic cavity, because the major lymphatic vessels are going to run through the thoracic cavity. When we take a deep breath in, that's going to actually help to suck some of the lymph up into the thoracic cavity, much in the same way that we use that thoracic draw to help to pull blood in through the venous system. We have vessels much in the lymphatic system, just like we have in the venous system. We're going to have lymphatic capillaries, okay, just like we have capillaries in the circulatory system. These are going to be the vessels that we're going to be able to absorb interstitial fluid through, because the lymphatic capillaries are going to be lined with simple squamous epithelium, much in the same way that the circulatory system is. From those lymphatic capillaries, we're going to then move the lymph into larger vessels. Now, these vessels, as they move through the body, are going to be designated as either afferent or efferent vessels. You may have, especially if you were in my class, you may have heard the terms afferent and efferent before. Remember, afferent is always carrying something towards, and efferent is exiting something. So in this case, we're talking about the vessels as they move towards or they exit some lymphatic organ. And usually the lymphatic organs that we're talking about are going to be lymph nodes. We're going to have lymph nodes kind of scattered through the lymphatic system. And these lymph nodes are going to serve a couple of functions, but one of their primary functions is going to be filtration. So as we're circulating this lymph through the lymphatic system to put it back into the circulatory system, we're actually filtering the lymph at the same time as it moves through by passing it through these lymphatic organs. And like I said, most of those organs are associated with filtration are going to be the lymph nodes. We have lymphatic trunks. The lymphatic trunks are going to be formed by joining multiple vessels to one point. There are basically 9 major lymphatic trunks. We have 2 jugular trunks, which we know are going to drain from the head and neck region. So we have a right and a left. We have 2 subclavian trunks. That's going to be where they are going to bring blood back from the upper extremity. We have 2 bronchiomediastinal trunks. Those are going to come from the thoracic region. We have 2 lumbar trunks, and then we have 1 singular intestinal trunk. So when you look at the model, you'll see these trunks labeled. And again, you should be able to identify where these trunks are just basically by the names of these trunks. Lymphatic ducts, these are going to be formed at the junction of our major lymphatic trunks. And we have 2 lymphatic ducts. We have the right duct and we have the left duct. The left duct is also called the thoracic duct. Now, the right duct is going to be a much shorter duct because it's not draining as much of the lymph from as large a portion of the body. The left duct or the thoracic duct is going to be doing the majority of the draining of lymph from the greatest portion of the body. Lymph is going to drain basically very unevenly. All right. The abdominal region, both lower extremities, the left side of the thoracic cavity, the left arm, and the left head and neck is all going to drain into the left side of this or the left subclavian vein. The right side of the body is going to be the right thoracic cavity, the right upper extremity, and the right head and neck. So that's all going to be drained by the right duct. So the left duct is definitely draining the majority of the lymph from the body. The cisterna chyli is going to be an enlarged portion located within the abdominal cavity that is going to be kind of a meeting place for multiple trunks to meet. Off of the cisterna chyli is going to basically be the beginning of the left duct. And that left duct is going to come up and empty into the left subclavian vein. The right duct is going to come up and empty into the right subclavian vein. We talked a little bit about circulation. Obviously, we mentioned thoracic draw. Another major way, though, that we're going to move lymph is through muscular contraction. Again, much in the same way that we said we were going to move blood through the venous system using skeletal muscle contraction. The same thing happens in the lymphatic system. In fact, this is one of the things that is recommended to patients after they have had surgery, maybe for things like a mastectomy, or where they've gone in and they've removed some lymph nodes to test lymph nodes in certain regions. They recommend exercise to help prevent lymphedema. Okay, which is swelling caused by by having less lymph nodes and less passageways for the lymph to properly circulate. Movement and contraction of those muscles is going to help to circulate the lymph much more easily, which is going to prevent swelling caused due to lack of movement of that lymph. Now, when we talk about the lymphatic system, we can basically break the lymphatic system down into lymphatic organs and lymphatic tissues. Lymphatic organs are basically going to be anything that is encapsulated, okay? Anything that has a capsular border on the outside of the organ. Or of the tissue. That's what we classify as a lymphatic organ. Now, we have primary lymphatic organs, and primary lymphatic organs are responsible for the production and the maturation of our lymphocytes. Primary lymphatic organs would be things like the red bone marrow and the thymus gland. Secondary lymphatic organs, which also will be encapsulated, these are responsible for the storage of lymphocytes and the filtration of lymph and blood. So your spleen and your lymph nodes, those would be classified as secondary lymphatic organs. Now, we have a lot of different types of unencapsulated lymphatic tissues. These lymphatic tissues are going to kind of be scattered throughout the body, and they're going to be used for basically antigen recognition. So that when we have pathogens enter our body, we need to have tissues available that can recognize these foreign antigens so that we can initiate the immune response. So we're going to have these lymphatic tissues scattered through the body. They don't really have any specific specialization other than to act as a first line of defense against these foreign antigens that enter the body. Lymphatic nodules, like the ones that we saw on the digestive model, okay, that big lymphatic nodule. These are just larger masses of cells that are located in kind of places that we need to have greater recognition because of contact with the outside world, like the digestive tract, to allow for us a more rapid response should we have some type of foreign pathogen or antigen try to enter the body from that surface. So we typically don't see nodules very far away from a surface. Typically, nodules are going to be very close to a surface, particularly a surface like the digestive system, where we're going to have contact with the outside world, where there could be possible entry point for some type of pathogen. All right, lymphocytes. Now, we talked about lymphocytes when we talked about the blood. We know that lymphocytes are second, okay, on the list, okay, of never let monkeys eat bananas. We know that they fall second in commonness in a normal blood smear. We said that lymphocytes were primarily going to elevate when we saw viral infections, but lymphocytes are going to be used for a lot more than just viral infections. It's just that they're most sensitive to those viral infections. Again, they make up about 20% of our white blood cell count. We know that they are going to have a very large nucleus. They're about the same size as our erythrocytes. And these are some of our longest living white blood cells. Now, lymphocytes are going to differentiate and basically are going to turn into one of three different types of lymphocytes. Now, we can't tell the difference between these lymphocytes and under a microscope. They're all going to look exactly the same, but they're going to be used in different times depending on what type of pathogen we are trying to fight off. T lymphocytes. These are going to be lymphocytes that are primarily involved in what we call cellular mediated immune response. Cellular mediated immune response means that they are on the lookout for cells that have antigens on them that are not matching to our antigens. All right, they are foreign antigens that are, we're talking about bacteria and viruses that have markers on them that say, hey, that you're not supposed to be here. That's what the T lymphocytes are basically looking for. Cell-mediated immune responses always involves a cell attacking some other type of cell. So T cells are really effective against things like parasites and fungi and viruses. And then they are the cells that would attack any type of foreign tissue. So they're the cells that we need to make sure are not involved after some type of transplant. B lymphocytes, these are going to be involved in antibody-mediated responses, meaning that they are driving to produce antibodies in response to invading antigens. These antigens typically are going to be found in body fluids, so things like bacteria are going to be, which would multiply in those body fluids. That's going to be what our B lymphocytes are going to be primarily responsible for. Now, T lymphocytes and B lymphocytes get their names based on where they are going to mature. A T lymphocyte is going to mature in the thymus, hence the name T lymphocyte. A B lymphocyte is going to mature in the red bone marrow, hence the name B lymphocyte. Now, the B lymphocytes get grouped into 5 different classes, all right? And these are the different antibody classes that we have in the body. We have IgG, IgA, IgM, IgD, and IgE. Now, what you should know for the physiology test for me, make sure that you know the percentages in which they're found. Make sure you know where they're found, okay? That IgG are found in blood, lymph, and in the intestines. That IgA is found in breast milk, sweat, tears, saliva, GI secretion, so forth. And then make sure you know what they're used to fight against, all right? So definitely study this little table right here for the physiology test. So put a star by it, highlight it, do whatever you got to do, but make sure you study this table and know the differences between these antibody classes. And then our last type of lymphocyte is our natural killer cells. And these natural killer cells are basically cells that are going to be cruising around the body, basically always looking for cells that don't have antigens that match ours, all right? Making sure that cells have the correct self antigens. If they don't have a self antigen, meaning a marker that says that it is one of our cells, then these natural killer cells have the ability then to fight off that particular cell. Certain tumor cells are going to be very susceptible to natural killer cells, and which is why they are some of the first cells to respond when we start to develop different types of cancerous tumors. All right. Now, again, make sure you go back and you take a look at that sagittal head model. We had those 3 tonsils on there, which actually one of those tonsils got tagged on this past test, and I basically gave everybody credit for that tonsil that got tagged on there, because I wouldn't have tagged the tonsil on the digestive system test, but I gave everybody credit. So if you missed it, it didn't count against you. And then, like I said, make sure that you can identify the structures. All of these structures will be structures that you can identify or should be able to identify on the model that I showed you on Quizlet. You do have some histology. Again, I would take a look at the video that Mr. McCurdy does. I'm going to actually upload you a picture of a lymph node as well, because I couldn't find one on Canvas. So I'll get you a lymph node uploaded and the spleen uploaded. When you look at the spleen, you're going to see 2 different types of pulp in the spleen. You're going to see what we call red pulp, and you're going to see what we call white pulp. The red pulp is actually going to stain lighter. All right, the white pulp is actually going to stain darker. The reason the white pulp stains darker is because the white pulp is associated with filtration of the white blood cells. And because the white blood cells have nuclei, they're going to hang on to the stain much more strongly than the red blood cells would, which is what we find in the red pulp. So when you look at the spleen, you'll see this darker stained area and these lighter stained areas. That's the difference between the red pulp and the white pulp. And I think I have a slide of the thymus. If I don't have a slide of the thymus, I will get a good slide of the thymus to get you. Any questions on the lymphatic system? Again, like I said, super short lab. That's why I wanted to get y'all in and out of here as quick as possible, so you can go and study some more. You have that one model really, and then like I said, this is not a lot of the physiology for the 3rd exam. The majority of the physiology for the 3rd exam, because we actually have 4 things that we cover for the 3rd exam, because we have this lab, we have the reproductive, we have the urinary, and then we have the acid-base lab. So there's a little bit less. You'll maybe see, I don't know, 8 or 9 questions on the physiology test, on the 3rd physiology test from this. All right. Nice short lab. I know y'all wish they could all be 30 minutes and you could be out of here. All right, so make sure you take care of your practical by 11:59 tonight. Make sure that you take care of your post-lab stuff for this lab today and do your Engage quiz before next week. Once y'all get your physiology test done, I will get those scores posted, and when I post them, I will include the extra credit points for the vital capacity that you did a couple weeks ago. All right. All right. Good luck, y'all. Y'all have a good weekend, and I will see y'all next week for the reproductive system.
Thank you.
All right.